There are 90,000 people under the federal poverty level, and in 2016, the federal poverty level for an individual was $11,000. I can't even imagine how I could make my life work on that kind of salary. And there's 90,000 people in the region that are in that situation. And right now we've seen lots of isolated impact. I think a lot of organizations have really put their mission and their drive and their energy into this, but we haven't had a North Star of saying we're all going to work on one big aim together. And knowing that all of my work that I do, improving the services that I do, and then when I coordinate it with others, that actually is going to be the thing that makes the change in ways that we haven't seen before. So that's what the point is. We've never seen this happen around the country in this way, so we're really excited about it.
The objective of the event of this Learning Session 1 is to really teach the science of improvement. We have really passionate, smart, hardworking people who are already trying to address poverty, but we haven't necessarily focused on process improvement.
Our first efforts are to get each of these community-based organizations to really work on their own services so that they are providing better services for their clients, whether it's homelessness or whether it's mental health, behavioral health. The big issue is how we can get these organizations to coordinate services for an individual.
Number one largest contributor to poverty today is I think people feel disenfranchised, not a part of, and when someone comes along and says, I mean, for me, it was a couple of professors in college that really, their belief in me propelled my belief in me. And when people believe in you, it's more power than I think most of us could ever imagine.
I'm very optimistic for our community, for all of Northeast Wisconsin, really. This improvement can't happen unless people are at the table with a real passion to make that improvement happen.
My biggest takeaway with this whole process is that we truly are sitting on the brink of transforming health in our communities with this model. We're one of 3 communities across the country that are using this new model and applying it to social determinants of health like poverty. And we're really excited to be a part of this work.
People in Northeast Wisconsin and the Fox Valley in general have a great care for one another. We have a community feel. A lot of people really care about those in poverty, and there's lots of really good work that's gone on, lots of dollars that's been invested in this, and we have a real opportunity to improve the way we work, to create some synergies between efforts and organizations and between people, and we have an opportunity for a breakthrough with this.
This initiative has the potential to change everything about this community and about how we look at poverty and how we respond to the concerns and consequences of poverty.